Live with Revive, and I'm Marcella Barrick. We're here once again at Dr. Matta's Cosmetic and Laser Clinic. We're here today to see a live procedure of a soft lift. So let's see if we can find Dr. Matta in the office now. There he is. Hello.
How are you? Good to see you again.
Good to see you as well. So we're going to go see a soft lift.
Yes, we're going to have a lot of fun today. We're going to do the soft lift, which is a combination of Botox Cosmetic and Juvederm. And then we're going to also talk about some of the therapeutic benefits you can get from Botox.
Okay, perfect. So your patient and client is already here.
They are. They're waiting for us right now, and we can show you the whole procedure.
Okay, perfect. So let's go take a look and see what it's all about. Let's go.
So Marcella, you see here we have Tawny, and we're going to look at some of the things that we can address. The soft lift combines Botox Cosmetic and Juvederm. And Juvederm is a filler, so it fills things in that have started to descend and deflate. So this area here is probably the most common, and if you frown for me, Tawny, you're mad. Okay, there you go. That's the most common area treated in the world with Botox. And this area here, the crow's feet, you start to get these radial lines coming out from the eye as well. Excellent area to treat with Botox.
Okay.
Down here, we start to deflate, where the cheeks start to go down. They make their way down to this area, which also creates this fold in there, the nasolabial fold. So that's where we put some Juvederm. And you can see when she was animating, you see these strong lines down here and what we call the mentalis. Okay. And this creates more of that milo-mental line here, the marionette line that a lot of women don't like. So by using Botox in this area, a little bit here to reduce the movement of these muscles, and some filler in here, here, and also in here, will give her a very nice soft lift. Here you go, Tawny. Give me a mirror and have a look. See how you like it.
Oh, I love it.
I'm pleased.
Very much so, especially here. Wow.
So as you can see, what we did is we lifted up the cheeks a little bit. We filled in the smile line, and we put a good amount of product down in this area to try and improve that marionette line. We also put a little bit into the chin, which is one of the areas that women don't realize as they age, it actually starts to drop. So when you prop that back up, it's a very useful look. You're not going to look overly animated or anything like that.
I really see the difference.
Yeah, it looks great. I'm very pleased with it. And then this is our Botox in this area and this area. And then that will take about 2 weeks to fully kick in, and we're going to bring her back at that time and see how everything is settled in.
Okay, perfect. So we're going to do another viewing about Botox, right? But this time it's going to be Botox for sweating and perspiration. It's summertime, right?
Yes, you got it. That's one of the most common things we do here, where we use the Botox in the underarms, in the hands, the feet, the scalp, any of the areas that really bother people for sweating. And
so it's almost like you can do Botox from head to toe.
You got it. So we're going to be bringing in another patient to show you that. And I think we're going to be finished with Tawny, and no one will even notice what she had done, and she just looks refreshed.
So we'll go into the other room and see the next client.
You got it. Okay.
Thanks.
Bye now.
Thank you. Love it.
So here we are. This is our patient who's already had previous surgery to try and improve her sweating. Unfortunately, it did not work. Okay. And we're going to be doing the Botox instead, and it works very well. About 95% improvement in sweating. Lasts on average about 7 months. It's covered by insurance and is completely safe, as is Botox, you know, even in the face as we did before. Botox has been around and approved for over 20 years, and that's one of the biggest concerns patients have. How safe is it? It's got such a great track record. It's one of the most investigated medications out there.
So what are you doing? Are you going into different areas now here for like the sweat glands? Like how exactly does it work? What you're doing? What specific areas?
What we do in this situation is we inject all over the underarm area, over the areas in which sweat is coming out. And
so how do you know what area to pick? Like, so I'm like seeing how you're doing different areas around. So I'm just trying to...
It's generally experience. As well, we do a starch iodine test on the first day that the patient comes, which we didn't show in this situation, but that way you get an idea of where the sweat is coming out. And it's an excellent question, because people who've had previous surgery will have a bit of a different pattern of sweating. So we're generally covering the whole area in which she's sweating, so that she'll have good coverage, and again, it will last on average 7 months or so. Okay, you're all done.
Perfect, thank you.
How'd it go?
Awesome, great, I didn't feel it.
Not a problem, great. So then you'll find that'll kick in about 2 or 3 days, and you'll be dry for the whole summer.
Perfect, thank you.
All right.
That's amazing. I love it. Well, we've learned once again what Botox can do and how fast it is and how safe it is. And we'll be coming back very soon to see some more skincare procedures. I'm Marcella Barrick, and we'll see you next time on Live with Revive.